Hello, this BTEC Sport and Exercise Science video is for Unit 2 Functional Anatomy. We are looking at the skeleton or the skeletal system. We are specifically in this video looking at a subtopic of D5 joints, the 6 types of synovial joint that you need to know both the structure and the function of. So just to recap, here are the 6 types of synovial joint. These are all your freely movable joint, and you may be familiar with several of these already. I've just in the corner down here put, I suppose, an acronym with some numbers that might make more sense as we go along. So 3, 2, 2, 1, 1. And this will relate to the names of the joints, the 6 types of joints, of course. So B for ball and socket, C for condyloid, and the numbers relate to how many planes these joints can move in, i.e. the greatest or the least range of movement. And we'll look at that as we work through this. But just before we get into the 6 individual types of synovial joint, I just want to show this and mention this. Now we'll go through these and this concept in a separate video. This is related to planes and movements, and you may from school have learnt about planes. Basically, all the movements at the joints happen in one of 3 planes. So we've got the sagittal plane, you can see over on this diagram. Sagittal plane is like an imaginary division of your body into left and right sides. Left and right, it divides the body into sides, sagittal sides. And the movements that happen in that plane are flexion, extension, dorsiflexion, plantarflexion, hyperextension. So the forwards and backwards movements of our joints. So the sagittal plane does the forwards and backwards movements such as those. Then we've got, let's go to frontal plane. The frontal plane is relatively logical in that it divides your body into an imaginary front and back side half, if you like. So front and back, frontal plane. And what that means is the movements that happen in the frontal plane are our left and right movements. Things like abduction, adduction, what we would do with our arms and our legs in a star jump. Lateral flexion, that's bending to the side. Depression, elevation, they are shoulder or scapular movements. So all the sort of left to right, sideways movements happen in the frontal plane. That leaves us the transverse plane. Now the transverse plane is this imaginary surface that divides our body into top and bottom halves. So if you think transverse, top and bottom, sagittal sides, frontal, front and back, it does become quite memorable. The easy thing about the transverse plane is it's all our rotational movements, whether it's rotation at the trunk or the neck or the hip or the shoulder, all rotational movements happen in the transverse plane. So medial and lateral rotation, supination, these are radial ulnar movements. Again, we'll learn about this in more detail. But I just wanted to introduce the sagittal, frontal, transverse plane because in the types of joints we need to know what movements happen at each joint and what planes those movements happen in. Circumduction, just before I move on, is a sort of conical movement. So if your arm circumducted, your shoulder obviously is connected to your torso, but your hand would make a big circular movement. So your arm makes a sort of a cone shape. That is circumduction. And circumduction actually moves in all 3 planes. So let's look at the first of our 6 types of synovial joint. And this is the B, and you can see that it's 3. So by the number being the highest, that means it will move, that we can have movements that are ball and socket joints in all 3 planes. The sagittal, the frontal, the transverse. B is for ball and socket. So structurally, a ball and socket joint, you can see an example over here, is a large round condyle. If you remember, a condyle is a large round bony landmark, a bump. So we've got a large round condyle that actually sits in the socket, the fossa of a different bone. So we've got a round condyle and a fossa. And the combination of those 2 bone shapes is the ball and socket joint. The only 2 examples we have in our body and you need to know are the shoulder, which is where the humerus, your upper arm, has a condyle that sits in the socket of the scapula, the shoulder blade. Okay, so the humerus and the scapula make up the shoulder joint. It is not a clavicle as well. Annoyingly, some of the mark schemes in your work suggest it is, but it's not, technically speaking. This diagram over here just shows a bit more of a technical diagram, just the shapes of the bones, this circular ball sitting in a socket, whereas this is a bit more of an anatomical diagram. So from this we can deduce that it's got that structure, and because of that structure, this type of synovial joint has the greatest range of movement. It can move in all three planes. We would describe that as being multi-axial, multiple axes. It can move about in different planes about all axes. So just as a little extra bit of information, the hip socket is much deeper and therefore more stable than the shoulder socket. It's a bit, because it's shallower, it's more vulnerable to things like dislocation. Okay, so there we have it, ball and socket joint. It's a round condyle shape fitting into the fossa socket of a different bone, and there's only two you need to know. You'll need to know the bones that articulate at these joints. Let's look at number 2 then. So the next one is C, condyloid joint. And this has a number 2, which means by deduction doesn't move in all three planes, it only moves in 2. So it's the next down in terms of the size of the range of movement. Now this shape of joint, the shapes of the bones, are similar to a ball and socket, but rather than being round, they are oval. So we've got an oval shape sitting in a socket, an oval shaped socket. So if you remember, ball and socket, round ball, condyloid, oval. Okay, make a difference between those two. The ligaments in these joints, it would apply to all synovial joints, but ligaments prevent over rotation, prevent rotation at all. So these joints cannot rotate in the transverse plane, whereas the ball and socket can rotate in the transverse plane. So structurally, it can move in sort of two planes, two lots of directions, and not in a rotational direction. So because it only works in the sagittal plane, it does flexion and extension, and in the frontal plane it does abduction and adduction. And the only joint you need to learn really is the wrist. So the wrist you can flex extend, like when you shoot in basketball, and when you wave to somebody you probably abduct, adduct, have that sideways movement. Please note, no rotation is possible at your wrist. I know you can turn your hand up and down, but that is not rotation at the wrist. That's a joint higher up towards your elbow. So just to summarise then, the condyloid joint is similar to a ball and socket, but it's more oval in terms of the shape, and it is biaxial. It allows movement in the sagittal plane and the frontal plane, but there is no rotation. So that's the one it doesn't do, and it's really only the wrist that you need to know. The third one then, we have the saddle joint. So saddle joint, as you can see over here, if you imagine that this lower sort of bone or structure was a horse, this is often the shape of a saddle, and then the person sits on top of the horse's saddle with their legs astride. So what you can see is the two bones are shaped to fit in each other, basically like two saddles. We've got a concave inside curving and a convex rounded curving. Each bone has a concave and a convex shape, which enables them to sort of sit into each other, interlock like this really snugly. So basically, imagine literally two horses' saddles sitting on sort of in between each other, if you like. So you need to remember that both bones have a concave and a convex surface that interlock. Now we know already, because of my numbers up here, that this is a biaxial joint. It allows movement in only two planes, not in a third plane. The two planes, it does allow movement in our flexion extension, the sagittal plane and frontal plane, abduction, adduction. So again, there's no rotation. So perhaps it's an easy way to remember both these number 2s that are biaxial, neither of them allow rotation in the transverse plane. Again, the only real example you need to know is the thumb, so the base of the thumb, not your knuckles if you like, but the base of the thumb, that thumb that you can wiggle sideways and you can flex and extend. Our fourth joint then is a hinge joint. This is a little bit more straightforward in terms of movement because obviously there's only one plane of movement movement happens in. But I want you to look at this shape over here. So again, this more structural diagram. What you can see is the bottom bone looks like a trough. A trough. Now, a trough, picture something you'd see in a field that a cow or a horse or a sheep drinks out of. It's that sort of literally a trough shape. And then this other bone is more cylindrical. It's rounded, isn't it? So it's like a cylinder. Now, if you look at the anatomical diagram, what we've got here is that in our elbow, the ulna has a big notch, a dip in the bone, and this is a cylinder shape. And the bottom of the humerus has a cylindrical end, so it's rounded if you like, which is the equivalent of this diagram over here. So we've got a trough and a cylinder, and that's the language I want you to use. If we were to be asked a question on the structure of a hinge joint, that's the phrase I want you to learn. The two bones are cylinder and trough shape. Cylinder being the round bit, trough being the depression bit. Of course, what you could, if you can understand this, this is a convex shape and this is a concave shape, but I prefer the cylinder and trough shape. Your elbow is uniaxial. What that means is it only allows movement in one plane, and that one plane is the sagittal plane, because what you can do at your elbow is flexion and extension. That's it. You can't rotate, you can't do abduction, adduction. All it does is bend and straighten. So uniaxial, just the sagittal plane, just flexion extension. However, there are three joints you need to know, which are hinge joints. Your elbow we've mentioned. Your knee is the same, and your ankle is also a hinge joint. Okay. Again, what you'll need to do is learn the bones that go along with these that articulate at this joint. So the elbow is the humerus and the ulna. So this is the humerus, this is the ulna. The knee is your femur, your thigh bone, and your tibia, your shin bone. Your ankle is both your tibia and fibula, and then the little bones, your tarsals, in particular the talus, which is a tarsal bone. So it's important not only you know how would I describe the structure of this joint, what movements can occur, what's its job? Its job is to allow flexion and extension in the sagittal plane. And then what examples around the body do we need to know, those three, and what bones articulate at those joints. So number 5, a pivot joint, P for pivot, and it's uniaxial, only one plane of movement. Now this is almost easy to remember because it's different from all the others. You can see by this diagram over here, or even possibly from this here, that is like a pin or a peg, that upward sticky up bit of these are the top 2 vertebrae of your cervical vertebra, your neck basically. So we've got a sticky uppy peg bone, and then we've got a circular bone. Now those two interlock. The circular bone sits on top of the peg bone, and that allows us to look left and right, to rotate our cranium, our head, left and right. That is rotation. Rotation to the side is called lateral rotation. Rotation back towards the midline of the body is medial rotation. Now another place, so that's the neck, the atlas and the axis. The axis is the pointy one, the atlas is the circular one. So there is another pivot joint that you do need to learn, and it's important you learn because it might well be a new joint for you to know about. This is called the radio-ulnar joint, and that's the clue. It's a joint between the radius and the ulna, just below your elbow joint. To be clear, this is not the elbow joint. That is a joint between your humerus and your ulna. This is a little joint just beneath your elbow, and it's a pivot joint. So you can see here that the radius has a sort of, I guess, a circular end, and then the ulna has a notch, a concave end or part, and that rounded bit sits inside that notch, and what it allows us to do is supination and pronation. So if you were to put your arm out ahead of you and you put your palm so it's facing up. And then without moving your arm, you just put your palm so it's facing down and doing that sort of upward, downward hand position. That is rotation happening at the radioulnar joint. And it's got posh names. When your palm is up, it's called supination. When your palm is down, it's called pronation. So it's easy to remember. Up is supination and pronation. But it's your radioulnar joint. It is a pivot joint. It only allows rotation. Your atlas and axis is a pivot joint. It only allows rotation. And because it only allows rotation in the transverse plane, we would describe it as being a uniaxial joint. Uni meaning one. We are at the end. So this is our last of the 6 synovial joints. Now this one is standalone. You can see by the number there is no movement in a particular plane or around a particular axis. It has a completely different type of movement between gliding joints or bones of gliding joints than any of the other joints. And what the gliding joint is basically some small flattish bones, often short bones, not always, but often short bones of the carpals and tarsals, you can see over here, just gliding past each other, just sliding past each other. There's nothing to rotate around, there's no axis involved. They just move in any direction, very slightly sliding past each other. Okay, so because there's no plane involved, no axis involved, we would call this non-axial, no axis. So it's non-axial. At least 2 or more flattish surfaces slide past each other, for example, between our carpals in our wrist, between our tarsals in our ankle, but also between the sticky out spinous processes of our vertebra. So if you imagine the lumps and bumps on the back of your vertebral column that you can actually feel, the lumps, if you do a back bend, those processes will just glide past each other as you move. And that is all that a gliding joint is. There is no plane with which movement happens in, just sliding movement in all directions. Last bit of knowledge then. What things can influence how much range of knowledge, how much range of movement there is at any of these synovial joints? Well, hopefully it's been clear by the explanations of the previous 6 types of synovial joint that it's a lot to do with the shape of the articulating bone. You know, what are the bones shaped like? Do they sit in each other in a certain way? Is it round? Is it oval? Is it flat? So the joint structure hugely influences how much movement can happen, what range of movement you have. If the soft tissue around the joint, so for example the muscles, the ligaments, the tendons are quite stiff, let's say somebody is quite sedentary or old, then that will limit your range of movement. If you have massive muscle mass, so if you're a bodybuilder and you've got big chunky muscles, you actually reduce your range of movement. Basically the muscle mass gets in the way. And the same would apply to fat mass. If somebody is particularly overweight, essentially that amount of tissue gets in the way of your range of movement. Obviously we can actively change our flexibility to help us be more flexible and increase our range of movement. But unfortunately, as we age, we can lose hormones, which will make us lose pliability in our soft tissues, in our muscles and our tendons. So it's really important that we actively keep flexibility throughout life. Unfortunately, males tend to be a little bit less flexible than females. So let's have a look at some exam questions that we've had. We've not had a lot specifically on this information in terms of short answers, but all of the information in this section is really, really important for those question 11s and those question 12s. So have a look. Identify a type of joint in the thumb. 1 mark. So because it says identify, it literally just wants you to tell what is this type of synovial joint. So you get 1 mark for saying it's a saddle joint. Lovely, easy question for us. Here's another one. It's given you an actual sporting context, so a swimmer doing breathing activity at the neck. And it says, explain why the type of joint in the neck allows the swimmer to move their head. So I think for 3 marks, we've got to earn this by perhaps giving a little bit of information about the structure that enables this swimmer to turn their neck sideways, to rotate their neck sideways, laterally, to be able to breathe. So here's the mark scheme. The type of joint is a pivot joint. So 1 point for just stating what it is, but it wants you to explain why this joint works. So pivot joints allow rotational movement. That's how they function. And the reason, explain why it can do that, is because of the shape of the bones. We've got a circular bone, the atlas, sitting on the peg-shaped bone, the axis at the neck. So 1 mark for stating the type of joint, 1 mark for saying what movement is allowed at that joint, and 1 mark for giving structural information as to how that joint is able to rotate and work in that way. There we are. So we've covered the 6 types of synovial joints. Really important that you connect not only the structural information, but the functional range of movement information, how many planes, what movements happen, and what bones are articulating at those joints. They really have specified in the spec the movements happen due to the shape of the bones, and that's why I've encouraged you to learn those little phrases like cylinder and trough.